Your legs and feet may be broadcasting urgent warnings from your heart that are easy to overlook. Right now, nearly 6.7 million adults in the United States are living with heart failure, a number that surprises many people who never connect their swollen ankles or icy feet to a struggling heart. Heart failure doesn't always burst onto the scene with crushing chest pain. More often, it whispers signs that get brushed off as aging, extra weight, or a long day on your feet. That stubborn ankle puffiness you blame on tight shoes. The tingling or numbness in your feet you chalk up to sitting too long. These may be your heart's last-ditch signals to pay attention. Welcome. If you're new here, we're glad you've joined a community committed to transforming health through knowledge. Tap subscribe and ring the notification bell so you never miss practical, life-changing insights. And say hello. In the comments, tell us which country you're watching from so we can cheer you on. Your path to better health starts with recognizing the red flags below the waist. Today we're unpacking 12 research-backed signs that show up in your legs and feet when heart failure begins. These aren't random hassles. They're your body's emergency alert system. Each symptom has been linked in medical studies to a decline in the heart's pumping power. Spotting them early can alter the trajectory of your health and, in some cases, save a life. Now let's dive into the warning signs of congestive heart failure. 1. Numbness or tingling in the feet. That foot falling asleep sensation can stop being an occasional annoyance and start shadowing you all day. Research in current heart failure reports underscores how common these neurological complaints are among people living with heart failure. Two main pathways explain why congestive heart failure can trigger numbness or tingling in the feet. The first is mechanical fluid pooling in the feet and lower legs leads to tissue swelling, and that edema can press on the small sensory nerves. The pressure disrupts normal signaling, producing numbness, tingling, or even sharp shooting pains. The second is metabolic. Reduced cardiac output can limit blood flow and therefore oxygen to the nerves themselves. Peripheral nerves rely on a steady oxygen supply to function. When that drops, the nerves may misfire, sending distorted messages that the brain perceives as tingling or numbness. Early on, these sensations may be mild and intermittent. As heart failure advances, they can become more persistent and intense. Some people describe the feeling as walking on pins and needles, while others report that their feet feel completely numb. 2. Skin changes. Glance at the skin over your lower legs and feet. Does it look glossy, as if pulled tight? Does it feel different, thinner, more delicate, oddly smooth? These striking shifts often reflect how fluid retention in heart failure is reshaping the skin itself. Research reported in Heart and Lung has described these hallmark changes in people with chronic heart failure. When congestive heart failure drives fluid into the tissues, the result isn't only swelling. The excess fluid stretches the skin beyond its usual limits, altering both structure and appearance. Normally, skin has a subtle texture that scatters light and looks matte. Under tension from edema, those tiny surface features are flattened, so the skin becomes taut, and light reflects more directly, producing that unmistakable shiny look. Because this sheen and tightness are so characteristic of fluid overload, clinicians often use them as a visual clue that significant fluid retention is present. 3. Worsening varicose veins. A sudden flare in existing varicose veins, or the rapid appearance of new ones, can signal something far more serious beneath the surface. Research in the Vascular Medicine Journal has identified a strong association between heart failure and the fast progression of varicose veins. Varicose veins arise when the one-way valves in leg veins weaken or fail, letting blood leak backward and pool in the lower limbs. Add congestive heart failure to the mix, and the problem intensifies. A struggling heart allows blood to back up, raising pressure throughout the venous system. That elevated venous pressure places extra strain on already vulnerable leg veins and their valves, accelerating their breakdown. People who once had only mild varicosities often notice a marked rapid deterioration over just a few months. When heart failure develops more swelling, more prominent twisted veins, and faster symptom progression driven by the sustained pressure overload. 4. Restless legs. You crawl into bed expecting relief, only to feel your legs twitch, cramp, and buzz with an irresistible urge to move. This isn't just restlessness, it's a pattern tied to the way fluid shifts in heart failure. A review in Sleep Medicine Reviews links this nighttime redistribution of fluid with the onset of restless leg symptoms in people with heart failure. Here's what's happening. During the day, gravity draws excess fluid into the lower legs and feet as compromised circulation struggles to keep up. When you lie down, that pooled fluid doesn't stay put, it migrates back toward the torso. As it moves, it can compress nearby nerves and disturb electrolyte balance, provoking sensations your brain reads as tingling, burning, crawling, or an urgent need to move. Compounding the problem, heart failure-related circulatory limits can already leave leg tissues short on oxygen. The nocturnal fluid shift intensifies that shortfall. The result is a perfect storm for nighttime leg discomfort. More misfiring nerves, more abnormal sensations, and more disruption just when your body needs rest most. Fave leg cramps or pain with walking. A few minutes into a walk, your calves seize your thighs burn, and you're forced to stop. Classic claudication. Among people with congestive heart failure, this is one of the most disabling day-to-day symptoms. Studies in the Journal of Cardiac Failure tie these claudication complaints directly to reduced cardiac output. Here's why it happens: when the heart can't pump strongly enough, it fails to deliver adequate blood and thus oxygen to working muscles during activity. The leg muscles, being large and highly active, are the first to signal trouble. With insufficient flow, they cramp, ache, and fatigue far sooner than they should. At first, you may notice this only during harder efforts. As heart failure advances, the threshold drops tasks that once felt easy. Short walks, gentle stairs can trigger the same painful tightness and exhaustion, making you pause more often and cut activities short. 6. Slow healing sores on legs or feet. When a tiny cut, scrape, or sore on your leg or foot, something that should mend within days sticks around for weeks, it signals a serious issue with circulation and oxygen delivery rooted in a weakening heart. Research published in the Journal of the American Medical Association highlights a clear link between poor wound healing and congestive heart failure. The findings show that people with heart failure heal significantly more slowly because of tissue hypoxia, a blunted immune response, and impaired circulation. If the heart can't pump effectively, tissues are chronically short on oxygen. Repairing a wound is highly oxygen demanding and relies on strong blood flow to deliver nutrients, immune cells, and the building blocks needed at the injury site. When heart failure restricts blood flow, even small wounds can become major problems, taking months to close, and in some cases, never fully healing. 7. Swollen ankles. Puffy, enlarged ankles are among the earliest and most visible red flags of congestive heart failure. As the heart weakens and pumps less efficiently, blood begins to back up, raising pressure within the veins, returning blood to the heart. Evidence reported in JACC, Heart Failure, shows that ankle edema is not only one of the most commonly recognized early manifestations of heart failure, but also a dependable indicator of how the condition will progress. When venous pressure climbs, fluid seeps out of the blood vessels and into nearby tissues. Because gravity draws this fluid downward, the ankles become the primary reservoir for the excess. What makes this sign particularly worrisome is its persistence. It typically doesn't resolve with rest or by elevating the legs. Instead, it lingers, often intensifies, and tends to become more pronounced as the day wears on. 8. Dusky or blue legs. If you glance at your legs and see an unsettling bluish or dusky hue, you're likely witnessing cyanosis, a striking, clinically important sign that your heart is struggling to keep blood circulating adequately throughout your body. Studies reported in ESC Heart Failure identify cyanosis as a key peripheral marker of congestive heart failure. It arises when deoxygenated, oxygen-poor blood begins to predominate in the circulation, especially in areas where blood tends to pool or move sluggishly. This bluish tint shows up first in the most dependent regions, your lower legs, ankles, and feet. As heart failure advances, the discoloration grows more persistent and intense, often extending from the toes and feet upward along the lower legs. It typically becomes most noticeable after long periods of sitting or standing. This visible color shift lays bare the severity of the circulatory strain and the profound impact on tissue oxygen levels. 9. Weight gain from fluid retention in the lower body. You step on the scale and find you've added several pounds seemingly out of nowhere, or 5 to 10 pounds within just a few days. When that rise comes with swelling in your legs and feet, it isn't fat. It's your body stockpiling fluid in response to a heart that's no longer keeping up. Reports in Mayo clinics. Proceedings flag sudden fluid-driven weight gain as a critical warning sign that warrants prompt medical evaluation. This isn't merely a change in numbers. It reflects a breakdown in the body's normal mechanisms for controlling fluid balance. Unlike the slow creep of weight from extra calories, fluid retention can spike rapidly. Many people describe putting on 10 to 15 pounds in a single week entirely from trapped fluid. Because gravity pulls that fluid downward, the excess often settles below the waist. Your calves feel squeezed by your pants and shoes that fit last week, may now be too tight to wear. 10. Muscle weakness in legs. Recent landmark work in circulation heart failure shows that people living with chronic heart failure commonly develop skeletal muscle weakness that limits everyday function. This isn't simple fatigue. It reflects a fundamental drop in your muscle's ability to contract and do work. When the heart fails to circulate blood effectively, the leg muscles are shortchanged on oxygen and nutrients. Researchers observed a decrease in myosin heavy chain protein within individual muscle fibers, changes that translate directly into weaker, less effective contractions. The result is difficulty with tasks that depend on leg strength, such as climbing stairs, walking longer distances, or sustaining activity. The study further noted that the worse the heart failure, the weaker the leg muscles, and that weakness can appear after only brief exertion. Importantly, this deficit often remains even when cardiac function improves with therapy, pointing to lasting structural alterations within the muscle itself. 11. Pitting edema. If swelling has appeared in your legs or ankles, try the same quick check doctors use. Press a fingertip firmly into the puffy area for about 10 seconds, then let go. If a noticeable dent remains for several seconds instead of bouncing right back, that's pitting edema, and it's a pivotal clue. Pitting edema isn't ordinary swelling. It's a distinct pattern of fluid buildup that signals a specific internal problem. Studies in the American Heart Journal have linked pitting edema directly to failure of the heart's right side. When the right ventricle falters, it can't efficiently move blood returning from the body to the lungs for oxygen. Pressure then builds in the venous system, causing fluid to leak from blood vessels into nearby tissues. The lingering indentation you see is the literal displacement of that excess fluid. The fact that the skin doesn't immediately rebound shows just how saturated those tissues have become. And 12 cold feet. Many people shrug off cold feet as a sign they need thicker socks or have poor circulation. But when the heart starts to fail, it's forced into triage, sending its limited output to what matters most: the brain, heart, lungs, and kidneys. As a result, the extremities, especially the feet, fall to the bottom of the delivery list. Research reported in Circulation describes this clearly. Patients with reduced cardiac output frequently identify persistently cold extremities as one of their most noticeable symptoms. What stands out is how the feet are often affected more than the hands. Being farthest from the heart, they demand the greatest effort to keep adequately perfused. Unlike the usual chill that eases with movement or warmth, heart failure-related coldness tends to linger no matter the surroundings. People commonly report feet that feel icy despite warm socks, proper footwear, or a comfortable room temperature, an unmistakable sign that blood flow is being conserved for vital organs rather than the periphery. After walking through these 12 warning signs, one message stands out: your legs and feet function as a highly sensitive early alert system for heart failure, often detecting trouble long before it turns life-threatening. Each sign we covered is your body's urgent signal that your heart needs prompt attention. The evidence is clear. These aren't minor annoyances to shrug off. They're research-backed markers of a disease that affects millions and claims more lives than many cancers combined. Catching these cues early can mean the difference between a manageable condition and a medical crisis. And remember, congestive heart failure rarely arrives with dramatic chest pain. It tends to whisper through stubborn swelling that doesn't fade with rest feet that stay cold no matter how warm your socks are, and sudden weight gain that appears overnight. All of these are your body asking for help. If several of these signs sound familiar, don't wait for them to fade or hope they'll resolve on their own. Contact your healthcare provider right away. Early treatment can significantly improve outcomes, quality of life, and longevity. If this video helped you recognize these critical warnings, type helpful in the comments. It truly motivates us to keep creating life-saving content. Please like the video. If you found value here, share it with someone who needs to see it, and subscribe for more health insights that could change your life. Thank you for spending time learning these essential signs. Recognizing them now may be one of the most important choices you make for your future.